And welcome back to Body Beautiful. We're welcoming Dr. Karen Horton, and we'll be taking any calls you might have with questions about cosmetic surgery. Here is the number to call, 800-440-4884. And again, we'll be putting that number for the doctor's office right up and during the segment, so be sure to take that number down. Remember, any advice we give you today, obviously, you want to consult your own physician. So welcome, Dr. Horton.
Thank you for having me.
You know, let's set this the record straight here. You are a board-certified plastic surgeon, very important, in Pacific Heights. Also, something special, you're a member of an all-woman plastic surgery practice.
Which is fairly unique in the plastic surgery world.
Unique meaning the only one of its kind in the country, perhaps?
Perhaps.
Okay. Now, we've got some show and tell here. Let's just jump right into it. You specialize in breasts.
I specialize in surgery of the breast and body. In our practice, we see a lot of women because we're women's plastic surgery.
Sure.
And we perform a lot of breast surgery. One of the procedures we perform is breast augmentation and breast reconstruction using implants.
Okay, you brought some implants.
I brought some implants.
We're going to be taking a look at those. Before we do though, let's go ahead and take a little virtual trip of your office here.
Sure.
We've got a video clip, and let's go right to that. There we go.
This is the outside of our building, and this is Judy. She's our front office manager. She will greet you when you come into the office. We take a full history and physical, and Nayu is showing that patient to my office. You can expect to spend at least 45 minutes with me when you see me in consultation, talking about what your goals are and determining which series of procedures will best meet those goals. Here I'm showing an implant shell, and we're talking about breast augmentation to this woman. Next, we're showing some samples, which we can actually show you live here, between silicone and saline implants. And
there is a profound difference. And you brought these and let me kind of check them out before we started. And I've got to tell you,
there's
let's
a big
start
difference
with them now.
This is a saline implant. It's filled with saline, which is salt water, the same salt water that's in an IV tubing and that you put in your eyes.
And it feels pretty much like a water balloon.
That's essentially what it is.
Okay.
And silicone is the other option for breast implants.
And that's why people like this, because it feels the most natural.
It has a more natural feel, a more natural look. It has less rippling if it's underneath the skin, which is very important to women in general, but particularly when we're using an implant for breast reconstruction.
Now, you brought another one here.
This is a new product which is coming, and there's been some interest in it. It's called the gummy bear implant.
And it feels just like a gummy bear.
Yeah, it's also
hard.
a silicone implant. It's called a cohesive gel implant, and the gel itself is a little bit less viscous, meaning if you were to cut or fracture this implant, it would just be two halves, just like a gummy bear. If you were to cut it in half, you would have a head here and a tail here.
Okay.
So this implant is another option which is up and coming. It will soon be approved by the FDA, we assume sometime in the next 6 months to a year. So it's going to be another option for women as well.
There was a controversy some years back about possible leakage in the silicone, and that's why we went to the saline, correct?
Yeah, silicone was removed from the market in 1992. There was a voluntary moratorium, so the implant companies took it off the market so that it could be studied more. These are the third generation of silicone implants. They have a thicker shell than previously, and the silicone is a viscous gel so that if there is an injury to the implant, when you squeeze it, it will leave the implant, but then it will go back in. So this is an implant.
So this is a ruptured silicone.
Is essentially a ruptured implant. I trimmed it in the office, and you'll see that if you squeeze it, it leaves the implant, but then it goes back in. So this is an example of the gel, which is on the market now.
So it's not at risk of migrating in the body?
Silicone is not permeable in the body. It does not travel anywhere. Whereas saline is permeable in the body. If there was a leak of a saline implant, we would know because a woman would wake up one morning and she'd be flat on one side if she had two implants. Silicone, on the other hand, is not permeable. It does not travel anywhere. Silicone is safe. All of the studies have shown that there is no association between silicone and any disease whatsoever.
And I suppose that will be a comfort to people that are trying to decide which way to go.
Exactly.
We're going to get a lot of calls, a lot of emails. We need to take a break, so hold that thought. We'll be back right after this break. For more information here, you can call the doctor's office, Dr. Karen Horton, 415-923-3067, or womenplasticsurgery.com. We'll be back right after this.